Welcome to Mental Health Matters with myself, Lisa Ann Butcher, and joining me is Katharine Smart, Dr. Katharine Smart. She has a very long, very accomplished list of accolades. And just to give a little bit about her, she's an experienced medical advocate. She constantly challenges the status quo in medicine. She is the host of her own podcast. The podcast is called Health Signals, and there's another one called Spark as well. With over 20 years of experience in pediatrics, she's worked in everything from emergency pediatric medicine to she's also the Yukon Autism Diagnostic Clinic lead. She is excited to bring her love of family-centered care to families in the Okanagan and is currently doing autism assessments for our community, which is amazing. Welcome, Dr. Katharine Smart.
Thank you, Lisa. It's great to be here with you.
Great to be here with you as well. So why we started the show actually initially was as a mental health provider in the community, I do run a clinic called Three Sisters Counselling, and we have multiple practitioners in all areas of expertise. And I've always found there to be a stigma, as I'm sure many of you have as well, about health, mental health in our kids, mental health in our ourselves, in relationships, and in our families. And I want to sort of break down the stigma, destigmatize mental health in general. And so we thought of doing this show in order to bring awareness to people about just how they are themselves, how they can be better, how they can learn to connect with themselves and their family members. And so today we thought we would start our very first, this is actually the second episode because the first episode was actually just explaining the concept of the show. But this is the first episode and Katharine is my first guest. We are going to be talking today about demystifying kids' health. So I think this is a huge topic because in my office every single day, I hear parents confused about what is going on for their kids. They want to know if it's, quote, normal. Is my kid doing okay? Is it okay that they are in their bedroom? Is it okay to have a device? Should I be vaccinating my kids? Does my kid have ADHD? So I think it's really important in terms of those topics that we start to discuss those things. Tell us a little bit about sort of where you've come from and why this is so important to you in terms of kids' mental health, but also being an advocate for kids' physical health.
Yeah, thanks, Lisa. So, as you said, I've been working in pediatrics for over 20 years, and I started my career as an emergency medicine physician at the Children's Hospital in Calgary. And over that time, when I first started working there until I went into more community peds, I really noticed this huge shift in what was bringing kids to the emergency department. So naturally, you have the usual things you would see, vomiting, diarrhea, fever, et cetera. But mental health was really a growing change from when I started my career to when I left emergency medicine. And part of the reason I decided to transition to more community-based pediatrics was I could see that this need to really support children around their mental health was growing, and it was an area where a lot of people didn't have a lot of access. So, I think those things that you outlined, just that, concern that parents have around their children, are things okay, are they not? Growing mental health concerns around children and youth, and all the statistics sort of are telling us that kids are struggling more with their mental health more than ever. I think it's really an area where we can have a lot of impact. And that really starts with what you said, which is parents understanding what's normal, what's not normal, when to worry, and how to best support their children, and also how to best understand, is this something that actually deserves a diagnosis, or is this just sort of a variant of normal? And I think with those things you touched on already, especially things like ADHD and things like anxiety and depression, it can also often be hard for parents to know, like, where on the spectrum are we? And how concerned should I be?
Mm-hmm. And that's a really good question. I mean, that's something I get in my office quite a bit. And actually, I have to say, I'm a mother of 3 kids, and I thought that myself, is that, when I grew up, I was terrible at math, right? And so then you were just terrible at math.
Yeah.
There was no diagnosis for that. I guess you could sort of look into it, but my parents didn't. They just, Lisa's not great at math. And now, people are going to see pediatricians and they're going to see physicians and getting, psych ed assessments and things like that. And people will ask me all the time in my office, like, is this a problem? And one of the first things I ask them is it affecting their day-to-day life? Mm-hmm. Is it affecting their ability to be social? Is it affecting their ability to connect with either you or friends? And something specific that comes up a lot actually is anxiety. I'm sure you see a lot of that, do you? In children and
yeah,
parents.
absolutely.
I mean, honestly, and parents as well.
Yeah, and I think, anxiety is such a fascinating thing because, again, it's a spectrum, right? Everyone has some anxiety. If you had no anxiety, you would just never get up in the morning.
What do you mean? I'm completely shocked all the time.
You would just be lying there going, I don't actually care. So that bit of anxiety that we all have is sort of what drives us, right, to deal with things and get on with our day. But anxiety can also be really crippling. And I think, what you said, I sort of use that same lens of, is this functionally impairing for the child? So a bit of some worrying is normal. Anxiety can ebb and flow. Different situations can make you anxious. But is anxiety for your child something where it's starting to actually impair their functions, that it's a day-to-day issue and it's keeping them from being able to do the things they like to do, keeping them from thriving? And I think that's kind of the line in my mind where it goes from, hey, this is a variation of normal to maybe this is a clinical problem and we should think about it more. Yeah.
Yeah, and I often talk to people about that, sort of the difference between barely surviving and thriving, and looking at where this problem falls in that spectrum. If you feel like despite all the, and this is what we do in counseling, right? We teach people coping skills in order to kind of use those to learn to thrive. But if you're using all of your coping skills and you're doing all the things and you're still feeling like, and I always do this when I say barely surviving, almost like we're sort of, drowning underwater, like I can barely keep my head above water. If we're using all of our coping skills and we're still barely able to keep our head above water, then either we need more coping skills or it's time to see a physician, or combine that with your counseling as well. So the other thing that jumps to mind is the way people parent and the anxiety that's created. Can you speak on that a little bit? And again, I mean, obviously we are perfect parents.
Well, I am. I don't know about you, but no, it's so important. And we talk a lot about in pediatrics about this idea of goodness of fit. And that really has to do with like the parent's temperament and the way they see the world and problems and how that pairs up with their child, right? So, anxiety, again, is one of those things where as a parent, you can help. And again, it's important, I think, not trying to blame parents for children that have anxiety or are anxious, because that it's not that it's your fault. But again, how you manage as a parent can make a big difference, right? So I think that is really important. And the most important thing I think we can do as parents is to co-regulate with our children, right? So what kids are really looking for when they're struggling, and particularly anxious children, is that you as a parent are showing up calm, able to listen and support them through that emotion. And that, I would say, in my experience, is one of the hardest things as a parent, right? Because when your child's anxious and spiraling, which always happens when you have to be somewhere, you're trying to get out the door, you're trying to get to work on time, and that's the moment your child takes to decide, I can't go to school or I can't do this or whatever. And they're in this spiral, naturally, that's when it can be really hard as a parent to stay calm and help your child co-regulate. But, what happens naturally if you get dysregulated in that moment, if you get frustrated, that'll just drive up your child's anxiety and it often makes it worse. So I think the biggest thing we can do to support our children and support kids who are anxious is to try to stay calm ourselves and recognize what our children are looking for is for us to make them feel safe and to give them an opportunity to kind of come back into that regulation and move forward. But, sometimes easier said than done.
Yeah. I mean, it's true, isn't it? It often lets you know your own triggers as well.
Yes.
And it's interesting because when people have multiple kids, they have different personalities, obviously. And I know for myself, I have 3 girls and very different personalities. I have one that's, you couldn't rile her up if you tried. And then I have 2 that are sort of varying degrees of sort of calm to anxious, kind of in between. And I find sometimes, depending also too on what's going on for me, it shows me my triggers in that when I'm having a time where I feel like I need to remain calm and one of the kids isn't calm, I can feel it viscerally, affect me. And it is really important to also remember that we don't need to solve the problem. And I think as parents, we're always looking to try and solve the problem as opposed to just, I see you're very frustrated. I'm sorry you're going through that. How can I best support you? Sometimes it's just giving them a hug, I find.
Yeah, absolutely. And I think what you said was really true, right? Just acknowledging their feeling and validating that their feeling's okay, right? So, we may not validate what they're doing, if they're being destructive or causing problems like that behavior is maybe not okay. And we can work with our kids around that. But I agree with you. I think validating that however they're feeling is legitimate and you're there and you want to listen is important. I think the other thing you said that's important for kids is acknowledging to our children that we also struggle with these things as parents, right? Because I think sometimes children can feel really isolated or alone, or their perception can be I'm the only child that feels like this, or I'm the only person in my family that feels like this. So I think sharing our own experiences, I feel like that too, or this is what my body does when I'm feeling anxious, or, sometimes I find it hard to control my feelings, can really normalize that for your child. And when they see you working on it, it kind of gives them permission to be a work in progress as well. So I think that's important.
I often talk about that actually in my practice, and I've done several mental health talks on it as well, is talking about how do we raise kids? I don't know how you were raised, but I was raised in the way, it was sort of, oh, Lisa, do you want the apple? Mommy's going to get you the apple. So, of course, one of your first words is apple or ball because it's identified. But it's not many of us that are raised in a way of, oh, Lisa, I see you're feeling frustrated. When mommy feels frustrated, this is what I do. And, we would learn to identify our feelings if we were raised that way, but also know how to approach it, right? And we're not really raised in that way. I mean, maybe potentially if you're raised by a psychologist or a psychiatrist or something like that. But most of us are just raised by sort of, regular people trying to do their job as parents, and we don't have those tools. So I often think it's helpful as a parent to say to your kids, I know when mommy gets frustrated, this is what helps me. And then just giving them some tools that way, even just modeling that. Which kind of brings me to my next thought. I mean, one thing I hear all the time in my office is, I'm worried that my child has ADHD. This is a huge thing. ADHD and autism, we are actually going to do a special with Dr. Smart again, talking about autism specifically. So please tune in for that. But speaking about ADHD, obviously nobody has the DSM-5 with them all the time. And normally as parents, we're not really sure what ADHD looks like, but we have certain things we notice in our kids and we think, geez, I wonder if they have ADHD. What are things that you're seeing? I mean, obviously you know how to diagnose ADHD, but what do parents come to you with thinking that they have their child developing ADHD, but it's not necessarily? And let's talk about sort of the myths around that.
Sure.
What's a myth around ADHD in kids?
Well, I think there's kind of a couple things you've touched on that are important. I mean, I think the first thing to understand is that ADHD is common. So it is one of the most common mental health or neurological diagnoses in kids. So certainly a lot of kids do have ADHD. It can look like a variety of things. It can be hyperactivity, which I think is what most people think of when they think about ADHD, as a child who's overactive, but it can also be being inattentive or trouble regulating focus and attention. And that version of ADHD can be kind of more subtle and harder to see. It's more common in girls, and some kids have both. So I would say, most of the time when people are coming to me concerned about ADHD, it's because it's somewhere in that spectrum. But in terms of, myths, I think that's the other piece of it is, sometimes people aren't really sure what's normal, right? So I think particularly in younger children where, a lot of episodes of emotional dysregulation or tantrums are normal, people may worry, is this a sign my child has ADHD, right? A child who's just active and likes to move and play, but it's a younger child, people may not be sure, is this in the normal realm, right, of what's normal for a kid that age? They may wonder, is that ADHD? And it may not be. And then I think the other place is sometimes if kids are struggling in school, I think it's good to consider ADHD, but there's a lot of other things that could be too, right? It could be anxiety. It could be a learning disorder. It could be, just a bad fit with the style of education for the child. So I think this is why, when you're wondering these things, unpacking them are really important. Because I think the common myth, right, is that everything's ADHD. But I think equally dangerous is the myth that having a diagnosis of ADHD is rare or bad, because it is very common. It's very treatable. And in my experience, it's one of the most rewarding things to diagnose and manage because you can make such a huge difference for children that do have that condition. So I sort of enjoy those consults because I think there's lots of opportunity to educate, but also lots of opportunity to really shift things in a more positive direction for kids that are struggling with that.
Thank you for that. That kind of brings me into another thought about, and it's a bit of a more touchy subject potentially, which would be medication and vaccination.
Sure.
So this comes up actually quite a bit. People have very strong opinions about whether or not they would vaccinate their kids. And I don't want to take it to necessarily a medical direction as to whether, but one thing I hear all the time, and I used to work in healthcare prior to being a mental health counselor. And so I would hear this then too, and it sort of still translates now into my office, is I don't want to vaccinate my kids. And if I do want to vaccinate my kids, I don't want to give them all the vaccinations all at once because of the impacts to their immune system. Can you speak to the impact to the immune system And I know, I don't want to, I do want to sort of rope this back into mental health as well. But the impact to the immune system that one would get just even walking out on the
Yeah,
street.
absolutely.
And so does that make sense when someone says, I don't want to give all the shots that they're supposed to get at this age?
Yeah, great question. And like you said, one of the most common concerns parents have. And I think, like you said, the link to mental health is this is often a stressor for parents, right? I've yet to meet a parent who doesn't want to do the best thing for their child. So I think when parents have questions around vaccinations, really coming from a place of legitimate concern, right? There's a lot of misinformation out there about vaccination. And I think a lot of parents get very stressed around the decision. And then they start to wonder these common things that people talk about. What should I be doing? So that with that issue specifically, I think it's really important for parents to understand that our immune system is really quite incredible. And it is constantly exposed to antigens, which are basically proteins that stimulate the immune system to have a reaction. So like you said, as you walk through your day, like just you take your child to the grocery store, you take your child to daycare or to a playgroup, they're going to be exposed to way more antigens in that one day than they would if they got all the vaccines at the same time. So it's really a myth that the number of vaccines that kids receive at a time are overwhelming to the immune system. That's not true. Their systems are easily able to tolerate the vaccines that they get. And the timing of the vaccine schedule is really designed to optimize protection for kids when they're most at risk. I think what's really important for people to understand is vaccines are probably the most well-researched intervention we have for children from a medical perspective. And they've had absolutely the biggest impact on child survival and reducing morbidity and mortality from infectious disease of really anything that we do. So I think people can feel really confident about vaccines. They're safe, they're effective, and they absolutely save lives.
Great. I wanted to talk to you a little bit about social aspects of kids. Something I see in my practice a lot is my child is not social. And so it's okay because he just likes time by himself. And what I end up seeing in my office a lot is kids who realistically, if we look at it as parents, they are in their rooms for hours on end on a device. Or if they don't have their device, they're just sort of in their room, not socializing either with the family or with friends. So some parents write this off as it's okay, it's just my child's personality. And there is something to be said for kids having downtime as well. What can you speak to in terms of, is that a myth that it's completely fine for kids to be in their rooms doing their own thing? Is it a myth that it's not great to be on a device for several hours? Talk about device regulation and also social aspects of kids.
Yeah, well, I think there's no question that screen time is an ongoing kind of challenging thing with parenting. And I think it's also really interesting because I think how kids socialize has changed, right? A lot of kids now do socialize over their devices, right? They're on Snapchat, they're playing video games and having like live chats with friends over that. And I think that, we know the evidence is sort of showing the way kids interact with each other has changed. But we also know that too much screen time can be detrimental for children, for their mental health, for sure. And we also know that social media can be a challenging space for children. So the flip side of that is, like anything, it can be good or bad. It really kind of depends on what they're doing. And those moments of socialization in a family, of course, are important. So I think when you've got a child who's kind of reclusive in their room, they're not wanting to join the family for dinner, they're not participating in time together with their family, and they're always in their room or they're always on their screens, that is really worrisome. And I would wonder a bit about, what's going on there, and what are they doing on those screens, and is it having potentially a negative impact on their mental health? So I think, making sure that children's screen time is monitored, that it's not excessive is important. And again, it kind of depends on their age, but you really don't want your child on screens for maximum more than 2 or 3 hours a day. And if it's getting beyond that, I think you're starting to get into the realm where I would be worried. And we also know that those certain moments are important for families. Like, so an example would be family dinner time. There's a lot of evidence that families coming together to share a meal together, having that time to sit and talk, phones apart, parents too, right? Because sometimes we aren't the best examples, is a really important part of creating that bond and creating those opportunities for your kids to share their day. So I think a child that's, like as you said, sometime alone, normal. Some kids are more introverted than others. That's normal. But if you have a child who's constantly hiding away, not wanting to join the family. That can be a marker of depression. That can be a marker, perhaps they're being bullied on social media. That can be a marker that their screen time's excessive, and it's kind of gotten into that realm where it's now impairing their interactions and the things that they should be doing that are more positive. Especially, I think, if you're seeing kids like also start to pull away from activities that they like, things they used to like to do, sports, going out with friends, and now they're not. When those changes start adding up, that for me would be a bit of a red flag up, is my child's mental health okay? So I think it's something as parents we need to be aware of, but I also think it's something we need to role model. I know certainly my kids call me out on the over phone usage on the regular, and they're not wrong. And I think it's something, sometimes we talk about having a family media plan where you sort of sit down and have these conversations, right? And making sure you have time together where everyone's put their phones and devices away, I think is important.
I think being present is so important, and it's such a hard thing to do as a parent, especially as a working parent. And I know my kids call me out on that as well, where, Mom, do you want to watch a movie? Yeah, for sure. And then, 2 minutes later, sort of, Mom, get off your phone. I'm not on my phone. And I am on my phone, but I don't even realize I'm on my phone.
Yeah.
So we've sort of come up with this idea that we have a bin in the kitchen that everybody puts their device in, and it sits over there, and just to be present and mindful, and to be honest, just to even connect and hear what other people are saying.
Yes.
And I know
100%.
that sounds terrible, but I'm like any other mom or parent, and we're not perfect, and we're just doing our best to try and kind of keep connection alive in the family. And I think it does start with us. So.
Oh, I agree. And I think that word that you said is so important, right? Connection. And that's really what kids are looking for from parents, right? Is to be seen, heard, understood, to feel that connection. And I think making sure those moments are happening each day is really important. And it's a big protective factor for your child's mental health, because when they have that connection with you, they're more likely to come to you if they're struggling, right? If they're being bullied at school, if something's happened on social media, if there's a change in how they're feeling, if they feel that connection with you, they're more likely to share that. And that gives you an opportunity to intervene and provide those supports.
Well, that sounds great. I think that probably summarizes all the questions I had in terms of anxiety and ADHD. We talked a lot actually about being social, and even a little bit about vaccinations, I think, which is important just because, especially now, it's the season coming up.
Yes.
And I think it happens every year where people, it creates a lot of anxiety and stress in the family of just what are we going to do, to be honest, at school as well. It creates stress there. So thank you so much for joining us. I really appreciate your expertise, and I look forward to having you on for our next topics. We're going to talk about autism, and we're going to talk about parenting, which is going to be a great one, I think.
Well, thank you, Lisa. It was a pleasure, as always, to see you, and hopefully our listeners enjoyed our conversation.
Thanks.